Hi, I'm Dr. Stacy, and today I want to talk to you about one of the most easily changed parts of healthcare by running our practice here at Paradigm Family Health, and that's cost savings. So imagine that you're sick. You have this cold, it's become this cough, it's horrible, you feel like you're wheezing, you feel feverish, you're coughing stuff up. You call your doctor. They don't have any appointments for the next week or two. What are you supposed to do? You're sick. You can't wait. You're only getting worse. So where do you end up? The urgent care, right? So with the urgent care, you can have some blood work done to see if there's any signs of infection. They might run a flu swab, a strep swab, COVID swab. Sound familiar? If you're at the right urgent care, they'll even do an x-ray. Well, in this example, they might even find a pneumonia. Well, you also have been so sick, your heart rate is going up, your blood pressure is going down, you're throwing off your immune system's going crazy on that blood work, and they see signs of serious infection. Instead of sitting there and taking care of you and having close follow-up, they need to go on to the next patient. What do? They send you to the ER. And do you need to be in the ER? No, not necessarily. You're otherwise healthy and you're doing fine. That's one of my favorite differences here. And it happens, well, frankly, more often than it should. We probably take care of patients about once a month where they are severely ill that I know that they would have wound up in a different path for their healthcare needs had they not wound up in our practice. But instead, because we're able to really listen to our patients, take time with our patients, see them on a daily basis or even multiple times a day as needed, we're able to avoid the ER when we don't need to go to the ER. Don't worry, this is not about a liability concern where I'm just trying to keep you out of the ER. So we have hospital and ER trained physicians here that have practiced in that capacity. They know what they were going to be doing if they took care of you there. And we have some of those resources here too. So we're able to help curb costs for healthcare, help you have a better experience, and generally a safer environment because we don't have that other sick stuff rolling around here that you do when you go to the hospital, right? And you're able to be with the doctors and the team of people that you've come to trust and love by forming that relationship over time. So it might sound crazy, but that is actually one of my favorite days when I'm able to get that pneumonia patient in here, give them the fluids they need, give them the antibiotics they need, give them a breathing treatment, get them feeling better, and then see them the next day and the day after, however often I need to see them until I make sure they turn the corner. It's one of my favorite things. And as always, we're actually on call. So if something went wrong, they could give us a call later that night and we could direct them then to the ER if we need to. Healthcare can be different. There's no reason it has to be what it is. Come join us here at Paradigm and you too can experience that difference where you're going to be listened to, taken care of, and not just treated like a number. No middlemen, just doctors.